Now we'll talk about in this session about the neurovascular supply, in which we talk about the nerve supply and the arterial supply. So remember that, let me remove the urogenital first. Right. So remember that the rectum receives arterial supplies through three main arteries. And those three main arteries are superior rectal artery, your middle rectal artery, and inferior rectal artery. Very easy to remember. So superior rectal artery is the branch of your inferior mesenteric artery. Your middle rectal artery is the branch of internal iliac artery, and your inferior rectal artery is the branch of your internal pudendal artery. And the venous drainage is the via corresponding, again, superior, middle, and inferior rectal veins. The superior rectal vein empties into your portal venous system, which goes into your what we call into liver, while the middle and inferior rectal vein empty into your what we call the wait a second, let me repeat it again. While your middle and inferior veins empty into the systematic venous system. And I talked about earlier that the superior drains into your portal vein, which goes into your liver. And anastomosis between the portal and systemic veins are located in the wall of anal canal, which is making this a site of portocaval anastomosis. Now we'll talk about the innervations. When we talk about the innervation, I mean the nerve innervation. In case of nerve innervation, if I'm going to add up the picture, which is down there regarding the nerve innervation. Okay, this is a bit complicated picture, but whatever, I just want to entertain you kind of that one. So in case of nerve innervation, we got the sympathetic nervous supply to the rectum, which is from the lumbar splanchnic nerve and superior and inferior hypogastric plexus. And for the parasympathetic supply, which is from your S2, S3, and S4 via the pelvic splanchnic nerves, and inferior hypogastric plexus, visceral, which is your afferent sensory fibers, which follow your parasympathetic supply. When talking about the lymphatic drainage, remember that the lymphatic drainage of your rectum is via your pararectal lymph nodes, which drain into the inferior mesenteric nodes. Additionally, additionally the lymph from your lower aspect of the rectum drains into your internal iliac lymph nodes. So this is it regarding the rectum. We have talked about all the details regarding rectum, so you won't need any other lecture in order to understand the rectum. So this is it. Keep visiting Tigers Schooling, and see you again with another video. For that, goodbye.